Bladder 11 is 1.5 cm lateral to the posterior midline, below the spinous process of T1. Going to find the inferior border of T1 and come directly lateral to it on the height of the paraspinal muscle. D12 is on the posterior midline, below the spinous process of T3. Stomach 25 is 2 cm lateral to the midline at the centre of the umbilicus. Stomach 27 is on the lower abdomen, 3 cm superior to the pubic bone, level with Ren 5.
Bladder 1 is located 1 fen medial and superior to the inner canthus of the eye. If a person scrunches up their eyes, a nice depression forms here, and that's where you're going to find bladder 1. Bladder 2 is located in a depression at the medial aspect of the eyebrow. Palpate along the supraorbital margin until you locate a nice dip at the medial end of the eyebrow. That's your bladder 2. Bladder 10 is located 1.3 cm lateral to Do15. It's 4.5 cm from Do15 to the mastoid process. So divide this area into 3 and just come a little closer to the posterior midline. You'll be on the lateral edge of the trapezius muscle. Gallbladder 1 is located very approximately half a cm lateral to the outer canthus of the eye. Palpate laterally to find the lateral orbital margin. Mark your point just on the edge of that orbital margin. Be careful not to move back into this fleshy area because there are other points here. Gallbladder 4 is located 3/4 of the distance between gallbladder 7 and stomach 8. Gallbladder 15 is located at the midpoint between Do24 and stomach 8. It's half a cm into the anterior hairline. To locate gallbladder 20, palpate up the groove in between the sternocleidomastoid and trapezius muscles. As you get to the base of the occiput, you will find a nice depression. Gallbladder 20 is in the centre of that depression. Sanjiao 23 is located towards the lateral end of the eyebrow in a nice dip on the supraorbital margin. If you palpate towards the end of the eyebrow, on most people you'll find there's a nice cleft in the bone. Stomach 2 is located 1 cm inferior to a pupil looking directly forwards. To find this point, you'll need to stand directly in front of the person, Palpate inferior to the pupil by about 1 cun, and you should feel a dip, which is the infraorbital foramen. Don't press too hard though, because there's a nerve here and it can be quite tender. Stomach 1 is located inferior to a pupil looking directly forwards in a depression between the eyeball and the infraorbital ridge. So to locate this point, you need to actually stand in front of the person, have them look towards you, and mark your point in a depression between the bone and the eyeball itself.
Large intestine 2 is on the radial aspect of the index finger. It's just distal to the second metacarpal joint. It's much better to locate this point with the fingers loosely flexed. Large intestine 4, you're going to find the length of the second metacarpal bone. So running your finger down, finding the base, making sure that you're not actually on the carpal bones themselves, finding the midpoint of that shaft of bone, coming between the first and second metacarpals, nearer to the second than the first in the muscle.
Large intestine 11 is located at the midpoint between lung 5 and the prominence of the lateral epicondyle of the humerus. Typically, this is at the end of the transverse cubital crease when the arm is fully flexed. Sanjiao points on the forearm are best located with the arm laying flat on the bed and the elbow turned outwards. To find Sanjiao 5, come 2 cun proximal to Sanjiao 4, in between the radius and the ulna. You should be on the radial side of the tendon of extensor digitorum communis. If the person wiggles their fingers, this tendon will come into relief.